Prayers.
Almighty God, who in thy wisdom and goodness has appointed the offices of rulers and parliament for the welfare of society and just government of men, we beseech thee to behold with thy abundant favor us thy servant whom thou hast been pleased to call to the performance of important trust in this land. Let thy blessing descend upon us here in this house assembled. Grant us that we may treat and consider all matters that shall come under our deliberation in so just and faithful a manner, to promote thy honor and glory, to advance the peace, prosperity, and welfare of this country, and of those whose interest thou hast committed to our church. Amen.
Correction and approval of records of votes and proceedings of the National Assembly sitting of Monday, 27th March 2023.
Honorable members, the record of votes and proceedings of the National Assembly sitting of Monday, 27 March 2023 is before us for correction and approval. Can any honorable member please move that the said record of votes and proceedings be considered and approved? Member for Opanyomi.
Honorable Speaker, thank you very much for giving me the opportunity. Honorable Speaker, I ask to move that the record of votes and proceedings of the National Assembly sittings of Monday, 27th of March 2023 be considered for correction and approval. Thank you.
Any seconder? Member for Lower Salum.
Thank you, Honorable Speaker. I rise to second the motion.
It has been moved and seconded that the record of votes and proceedings of the National Assembly sitting of Monday, 27 March 2023 be approved. Any correction or observation from honorable members may do so by show of constituency tax. We'll begin by looking at page 1. We'll go through page by page and page 1. The member for Bakau.
Thank you very much, Honorable Speaker. Under collection and approval of records of votes and proceedings of the National Assembly sitting of Thursday, 23rd. Instead, 23rd Thursday, it should be Monday, the 27th. 27th, Monday.
Instead of Thursday. On page 1, second item, correction and approval of record of votes and proceeding of the National Assembly sitting of Thursday, 23rd March 2023. It should be Monday, 27th. That's correct. That's correct. It's correct because this was approved yesterday. Yes. Any other member for Jara Central?
Thank you very much, Honorable Speaker. After item number 3, laying of papers and report, the S is missing there for paper. And then under 3, Roman letter I, report of standing committee, there should be the article D inserted between of and standing. Thank you.
Honorable members, on item 3, laying of papers and reports, he is suggesting to add S to the paper. Laying of papers and report, and on Roman figure 1, report of standing committee, he is proposing to include the article D, report of the standing committee on public petitions. It's for the honorable members to agree. Any other observation? Yes, Kiang West.
That's correct.
Thank you. Page 2. Any other observation for correction on page 2? Page 3. Page 3, any? Page 3. Page 4. Member for Sami. Page 4.
Thank you. Thank you very much, Honorable Speaker. Roman number 3 down. Honorable Speaker invited the Honorable Chairperson, member for Woolly East, to move a motion to table the report. There is something missing there. Chairperson, it should be member for Woolly West. Sorry, Woolly East. You see it? Huh?
On item 3, page 4, Roman figure 1, report of the Standing Committee on Public Petitions on the petitions from the Woolly East Animal Protection Association by the chairperson of the committee. You are referring to the next line item, that is the Honorable Speaker invited the Honorable Chairperson to move a motion to table the report.
Yeah.
What is missing?
Yeah. What member for Woolly is?
The report was tabled by the chairperson.
Member for Woolly is missing.
Instead of chairperson, you want us to?
A chairperson, stroke, you said member for Woolly is to move a motion.
I'm not sure if that is necessary, because in this instance, it was the chairperson who presented the report.
All right. Okay. All right.
But it is for the honorable members to. Member for Bakau?
Yes, page 4. Under the following members participated in the debate. Honorable Yahya Sanya, number 13. He was not here during the debate.
Yeah.
Kiang West?
Yes, for consistency purpose, what Honorable Samuel was correcting, we did corrected one here yesterday. That was what the report that was led by Pan-African Parliament delegation. We corrected that one to include Honorable Chairperson for Lower Salem, Upper Salem. We've done that yesterday. So this is why he is calling it for today as well. If it is necessary, we put it. But yesterday we corrected and slotted the constituency for the chairperson for the other committee.
Maybe that must have been during the ensuing debate also. But I think normally we only stop at the chairperson. But it's for the honorable members to agree or disagree. But I think it's okay like this. I'm not sure yesterday.
That was also about laying of the report. It was about it was Woolly is who in fact suggested that amendment.
Thank you, sir. It's for the assembly to. The member for Banjul North.
Thank you, Honorable Speaker. I just want to bring the attention of the House. Number 3 of page 4, that is the lane of papers and reports. Roman figure 1, report of the standing committee. Like the other one, report of D, the word D is missing.
Like we did earlier on, he wants us to add the.
And any other place.
And wherever it appears in the report. So for the member for Nyamina West.
Thank you, Speaker. On the same page, where you have the following members participated in the debate. Number 11, Honorable Birom J.S.O. Nyamina East should be Nyamina West instead of East. Thank you.
Thank you. Honorable Birom J.S.O., member for Nyamina West instead of Nyamina East. Any order on page 4? Member for Brikama South? Page 4, can we move to page 5? Member for Woolly East?
Yes, thank you, Honorable Speaker. On the question put and agreed to, Roman figure 2, report of the Standing Committee on Public Petitions. It should be public petitions. That's the committee, Public Petitions Committee.
It is Roman figure 2, report of the Standing Committee on Public or Petitions. Yeah, to add S, and wherever it appears. And the article here is missing as well, what we did already. Page 5, any more? Member for Jara Central?
Thank you very much, Honorable Speaker, once more. Question put and agreed to.
Which page?
Page 5, same page. The report was unanimously adopted with amendments.
The report was unanimously adopted. No, there was no amendment.
There was no amendment. But I could remember member for Brikama North raised that issue, and then with the speaker.
No, I think what the member for Brikama North raised was in respect to the motion that the member for Olyundo wanted to raise, that let's adopt the report as it is, and then to enable them do their work. Because there was this proposal for a motion to put it aside and to allow the investigation to continue. But his was, let's just adopt it. It will help them, and then we will move forward from there. And it was unanimously adopted, accepted and adopted. I don't think there was amendment. I'm not sure. Member for Brikama North. Member for Brikama North. The member for Brikama North. Can you use your mic, please? No, use your mic.
Issue about the report, that is the inactiveness of the police. Eh? This is a different one.
This one is this one wasn't amended.
This is the port. Okay.
The second one was adopted without debate, so there was no amendment. I don't think there was no amendment. Yes, the member for Nyamina West.
Thank you very much. Page 6. Page 6. Where you have the second line after Honorable Alaji S. Dabo says, was seconded by Honorable Ablai Sise, member for Josuan. Instead of Josuan is Olyundum. Thank you.
Honorable Abdullah Sise, member for Olyundum instead of Joshua. Any other observation on page 6? The member for Woolly East.
Just a minor one, down the last paragraph, or the second to last paragraph, second line, where it says moved a motion to amend to clause 6. So it's just move a motion to amend clause.
Which page?
Page 6.
Page 6.
Yeah. The paragraph.
Move a motion.
Second to last paragraph, second line.
Okay, go ahead.
Where it says moved a motion to amend clause 6. It should have been clause 6 instead of to clause 6. We removed the to before. Before amend and 6, the to, the clause, we removed that to.
Oh yeah, move a motion to amend to clause 6. That to should be deleted.
Yeah.
Page 7. Page 7. Page 8. Page 8. Member for Woolly is
Page 8, where is a consideration, and then the numbers are there. One, where is a questions put. It's just the question put. You've seen it?
yes.
Yes.
Yes. Number 2. Number 1. Instead of questions, it should read as question. One question was put. Thank you.
Yeah, Honorable Speaker.
Jara Central.
Yes, I still want to maintain that there should be some rectification on that question put and agreed to, where it says the report was unanimously adopted. It should be with amendment. If you go to the Hansard, that's what you will find there.
Yeah, page.
Come again, you say, come again. Which page?
Page 5. Question put and agreed to. The member for Birkama South or Birkama North raised his tag yesterday to address the speaker so that he can change his question. Because his question was, the report was adopted unanimously and he stopped there. The member for Birkama North told him that no, it should be adopted with amendments. And he agreed to that.
Or the,
So it should be
yeah,
captured.
because I think on, yes, page 5, that deals with the force report. Yes, the force report was adopted with amendments. That's the first report. The second report was adopted unanimously without amendment, without debate, yes. The report was unanimously adopted with amendments. Yeah, he's right. Thank you, Honorable Member for Jara Central. On page 8, any more issues on page 8? Honorable members, I now put the questions. It has been moved and seconded that the record of votes and proceedings of the National Assembly sitting of Monday, 27 March 2023 be approved with amendment. Those in favor, please say aye. Those not in favor, please say no. The ayes have it. Clerk, we may proceed.
Minister's reply, order 100. Minister's reply to the report of the Select Committee on Health, Disaster, and Humanitarian Relief Parliamentary Inquiry on the Acute Kidney Injury, DKI, by the Honorable Minister for Health.
Honorable members, after the adoption of the Health Committee's report on the acute kidney injury, AKI, in the previous session, the report was submitted to government, in particular the Minister of Health, for consideration and reply as per Order 100 of the Standing Orders of the National Assembly. Accordingly, therefore, the Honorable Minister for Health is scheduled today, Tuesday, 28 March 2023, for his reply, reply to the report. May I now invite the Honorable Minister for Health to take the podium and make his statement. Honorable Minister.
Distinguished Honorable Speaker and National Assembly members, I wish to extend my sincere gratitude for giving us the opportunity to respond to the recommendations put forward by the National Assembly Select Committee on Health inquiry, following the inquiry into the acute kidney injury resulting to the death of at least 66 children in the Gambia. Honorable Speaker, if you may allow me, I'll go through the recommendations and then the response of the ministry to those recommendations, if that is okay. Number one, that there is urgent need for a functional National Medicines Quality Control Laboratory, NMQC lab. The Select Committee is reliably informed by the Ministry of Health that the World Bank is funding the construction of one modern QC lab. The Select Committee therefore recommends the government through the Ministry of Health to intensify efforts to complete this task as quickly as possible, bearing that it is a requirement under Section 50 of the Medicines and Related Products Act 2014. The committee further recommends at this stage to establish the laboratory under the control of MCA, as it is the international best practice. A parallel or autonomous authority created now will generate conflicts of command with different priorities. Samples from MCA will be handled at the convenience of the lab authority, which may result in delays. An independent national laboratory can be built in the future to support MCA with more advanced and confirmatory tests. Our response is MCA is working with the Ministry of Health to get the QC lab, Quality Control Lab, established through the support of the World Bank. We already have a farm doing the drawings, and a farm for construction is being sought. This lab will also include a food quality control component as well. The land is already available and construction work will soon start. Number two, the government prioritized the need for an urgent establishment of a functional pharmacovigilance PV unit at the MCA, and they hereby recommend for its immediate establishment in January 2023. Underreporting of adverse drug reactions is not unusual, but constant reminders and encouragement from the Ministry of Health and the MCA to both private and public sectors, including the public, may improve the situation. Our response is, there is a PV, that's pharmacovigilance system, in place under the MCA, but it needs to be strengthened. MCA has requested for technical assistance from the WHO to support the PV system, and the terms of reference, TOR, has been developed, and WHO is working on it. There is need for continuous engagement of healthcare workers to improve reporting by conducting sensitization trainings. MCA has secured funding for training of only 25 health workers, which is due end of March 2023. More trainings are needed, but the current MCA budget is limited. We will continue to engage the partners to decentralize the training so that all our health workers are conversant with the processes. Number three, the government harmonizes the pharmacy regulations with the West Africa region. MCA should involve our sister countries such as Nigeria and Ghana and others, and are encouraged to meet routinely for on-the-spot assessment. Our response is, MCA is in collaboration with the regulatory agencies in Nigeria and Ghana. With regards to the harmonization of regulations, MCA is already involved with the WAHO, that's West African Health Organization, harmonization initiatives and program. Ministry of Health is also working to review the laws in line with the Africa region. A legal firm has already been hired to coordinate this process. Number four, that the government, through the Ministry of Higher Education, Research, Science and Technology, to establish a school of pharmacy at the University of the Gambia to train more pharmacists and strengthen regulatory and healthcare delivery institutions. Our response is, the university has already agreed to proceed and World Bank is ready to support the process. The postgraduate committee at the Edward Francis Small Teaching Hospital, EFSTH, has been supporting the process. Number 5, that MCA to blacklist maiden pharmaceutical products and ban all their products in the Gambian market. Our response is, MCA has banned all maiden products since October 2022, and this ban will continue. Number 6, the government should consider pursuing legal action against maiden pharmaceuticals for exporting contaminated drugs to the Gambia with the Atlantic brand name. Investigation has revealed that Atlantic Pharmacy Gambia has followed all regulations for importation of medicines, including the batch that had the contaminated syrups. Our response is, the Ministry of Justice is already looking at the reports for advice on the way forward. Number 7, that government to strengthen MCA's capacity with the needed financial aid, infrastructure, and human resources for more effective and efficient implementation of its regulatory functions. Our response is, this will be difficult to ensure as the current budget for 2023 does not allow recruitment of additional staff and the operational budget has not been increased for 2023. MCA can only strengthen its capacity to increase in human resources and infrastructure by increasing its subvention, in addition to getting full approval to use its internally generated funds to support its operations through its strategic plan as approved by the board. Number 8, that MCA to ensure compliance by both the public and private sector to the regulatory requirements of the Medicines and Related Products Act 2014. Our response is, this is being strengthened and the efforts will continue with support from government and partners. However, it has to go in line with strengthening of the MCA capacity. Number 9, that government strengthen MCA and recognize them to operate as an autonomous agency for effective and efficient regulation. Our response is, the laws are being reviewed and will be strengthened. Number 10, that government to equip the hospitals with the required medical products or supplies for the effective and efficient management of patients. Our response is, this is an ongoing process. The new health insurance scheme will help to enhance this with other support from government and its partners. Number 11, that the Ministry of Health to review the primary healthcare system for early detection of medical cases for more effective and efficient healthcare delivery. Our response is, the strengthening of primary healthcare is government strategy. We have also started strengthening the surveillance system in the country. Working with partners, we have started sentinel surveillance in 2 areas, and we will gradually expand. The primary healthcare revitalization program is high on our agenda, and we have started engaging partners for support. Number 12, that MCA must increase background checks on companies from which pharmacies or importers buy medicines. In doing this, on-site visit to the manufacturing drug companies should be done by MCA before granting permit to any importer. Our response is, MCA is working on operationalization of the good manufacturing GMP inspections and is engaging organizations for pre-shipment inspection to start by April 2023. Number 13, that pharmacies should be encouraged to buy jointly so that they have a higher buying power. This will ensure that they can purchase from the high-quality companies, and they could also get certificates of analysis for the products. Our response is, this has started and it will continue. We also believe that ensuring registration of all products will encourage that, since the current practices of multiple importers bringing in small quantities of products will be discouraged. Number 14, that the Ministry of Health, as a temporary measure, the Select Committee believes the idea of every pharmacy having a supervisor should be reconsidered, and more emphasis should be placed on quality control at the point of purchase of the products, the processes, and the proper following of the regulatory frameworks. We therefore recommend MCA to strengthen supervision at the ports of entry. Our response is the commencement of the process of reviewing the laws is a new opportunity to look at the issue of every pharmacy having a supervising pharmacist. MCA has engaged in discussions with the pharmaceutical business importers, which is ongoing. MCA has also started screening tests using mini labs of some products which are sampled after importation. As MCA cannot employ more inspectors in 2023 because of budgetary constraints, it will be challenging to increase supervision at the various ports of entry, and this is critical. With the completion of the setting up of the Food and Drug Quality Control Lab sometime this year, this will all be strengthened. Number 15, due to the high cost of medicines in the Gambia, which is partly due to testing and importation payments levied on importers, MCA should consider a reduction in the cost of medicines for the public for collecting payments for registration and listing in Dalasi, and by also accepting payments for testing in the local currency. MCA as an institution can convert these funds to foreign currency through the existing banks as a short-term measure. In the long term, MCA to minimize outsourcing testing abroad and establishing. Our response is, MCA is working with Ministry of Health to get the quality control, that's QC lab, established through the support of the World Bank. The collection of registration fees in USD is important for MCA, as the testing laboratories being engaged need to be paid in US dollars or other hard currencies. However, consultations will continue to look for amicable ways in dealing with the challenge. Number 16, that the Ministry of Health and MCA must ensure that all medicines brought into this country are registered and listed. MCA and the Pharmacy Council of the Gambia, PCG, staff should be attached to GRA offices in key entry points, the airport, the borders, and weekly markets, to monitor pharmaceutical products imported into the Gambia, into the country. Our response is, registration of all medicines is a continuous work in progress, and MCA will strengthen it. Unfortunately, posting of more staff at the ports of entry is a big challenge because the proposed budget for personal emoluments, that's PE, that will make this possible was not approved. We solicit for the support of the National Assembly on this. Number 17, that the Pharmacy Council of the Gambia, PCG, to carry out its regulatory mandates effectively, it requires the establishment of a functional secretariat with an annual subvention to enhance its pre-qualification, pre-qualifying, registration, supervision, enforcement, and monitoring functions. Our response is, the Ministry will work with the Council to strengthen their human resource capacity. We will need the support of the National Assembly in resource allocation. Number 18, The Ministry of Health should continue with its extensive and rigorous sensitization of the population in local languages in all the healthcare outlets about the risk of self-medication and the consumption of medicines in the unregulated market. Our response: this will be strengthened by the Health Promotion Unit in the Ministry of Health. The recent acquisition of a film van through the World Bank support will enhance this, as the van will travel across the country disseminating the messages. Number 19, that the relevant government ministries and departments are recommended to visit their initial emergency responses to the AKI tragedy in collaboration with relevant CSOs and CBOs to address the issues of the victims and their families. Our response is this will be ensured. Number 20, that the Ministry of Health and MCA ensure that all medicines are registered before importation in the Gambia. This will require MCA to conduct site visits to inspect the manufacturing sites. Where site visit is not possible, the MCA can liaise with Gambian Embassy, the Gambian Embassy or High Commission at the exporting country to assign an agent for the site visit and submit a report accordingly. In the absence of a Gambian Embassy or High Commission in the exporting country, that of another Commonwealth country shall be authorized to assign an agent. Our response is this will be ensured. Number 21, that for medicines from less stringent regulatory countries, the MCA shall assign WHO accredited laboratory to conduct the pre-shipment inspection and QC testing of each consignment and be further verified by MCA agents at ports of entry. Our response here as well is that this will be ensured. Number 22, that all medicine products should be subjected to screening before release into the market for distribution and use. This will ensure that what is ordered is what is delivered to avoid what happened in the case of Atlantic Pharmacy. Our response is this is currently a big challenge for most countries in the world, including the Gambia, because of the huge costs, material, and human resource requirements for regulatory agencies. The WHO recommends random sampling and testing of 5 to 10% of products. With the establishment of our own food and drug quality laboratory control lab, we will endeavor to ascertain screening of all products. Number 23, that MCA should revisit its standard operating procedures for importation to ensure that those suspected to be substandard, falsified, and counterfeit items are quarantined for further investigations, including QC testing at the cost of the importer. Our response is the SOPs for importation complies with this requirement. MCA will, however, ensure that QC testing costs are borne by the importers. Number 24, that random sampling of each imported medicine should be conducted and the result kept at the MCA. This practice will keep importers on their toes, ensure at least 5% of all randomly sampled medicines are annually tested, e.g. 2.5% each 6 months at the cost of the importer. Our response is this is currently being done through the risk-based surveillance being undertaken. Number 25, that all premises, wholesale pharmacies, retail pharmacies, and drugstores shall maintain a real-time electronic database tracing all medicines from importer to user. This will help tracing and recall of medicines as well as for easy retrieval of information. Our response is this recommendation should be implemented by the Pharmacy Council of the Gambia. All stakeholders will be engaged to ensure this. Number 26, that government should provide compensation to the families of deceased and surviving children. This should include free medical care for the surviving children with acute kidney injury until they obtain full cure and recovery. The response is the surviving children are currently being followed up and they are receiving free medical care. Government is reviewing the reports and waiting for the pending report of the inquiry set up by the government. Once these reports are all reviewed, the issue of compensation will be addressed. 27, that as a matter of utmost urgency, the Ministry of Health must consider revisiting the Medicines and Related Products Act to give clear and direct powers to the MCA to regulate and impose sanctions on the sector without having to seek the approval of the Minister of Health. This is to prevent interference and effectiveness of the agency and its decisions. Our response is the MCA currently has those powers and does not need to consult the Minister for that. However, the process of reviewing the acts has begun and the Ministry has secured a law firm that is looking at the different laws. 28, that as a matter of utmost urgency, the Ministry of Health must consider revisiting the Pharmacy Council Act to give clear and direct powers to the Pharmacy Council of the Gambia to regulate and impose sanctions without having to seek the approval of the Minister of Health. Our response here is the Pharmacy Council currently has those powers and does not have to consult the Minister for that. However, the process of reviewing the Act has begun to ensure best practices. Number 29, that the government uphold the decision to suspend the Atlantic Pharmacy Gambia Limited. Our response is this will be withheld and the Ministry of Justice will guide on the next steps. Number 30, that the Select Committee to further investigate matters affecting the effective and efficient operation and administration of the Medicines Control Agency. Our response is this is welcome as it will help strengthen the MCA for optimal functions. Number 31, the Ministry of Health should become more vigilant and play an effective oversight over the MCA and PCG to ensure that they are effectively executing their functions without interfering in their operations. Therefore, the Select Committee recommends for government through the MOH to speed up reviewing of the laws and regulations governing the pharmacy and drug regime in the Gambia and table it before the National Assembly. Our response is this will be expedited. The process of reviewing the laws has already started. A law firm has been assigned to start the process. This is supported by the World Bank. Distinguished Honorable Speaker and National Assembly members, this is our submission to the report of the National Assembly Select Committee on Health on the issue of the acute kidney injury incident in the Gambia. Thank you very much.
Thank you, Honorable Minister. Honorable members, pursuant to Order 48.6 of the Standing Orders, and I quote, after the statement has been delivered in the Assembly, a period of questions on the statement, which shall last no more than 1 hour, may then ensue. The Speaker shall determine the period taking into consideration the content of the statement, the number of members wishing to ask questions, and the pressure of other business. On that note, I wish to invite honorable members to ask questions to the Honorable Minister in respect to his statement. This process will continue. And first on my list, the Honorable Member for Central Baribu.
Thank you, Honorable Speaker. Honorable Minister, in your statement, you made mention of construction of a functional lab. The House wants to know how far are you going with the construction? And the other part of it is you made mention of World Bank supporting you. what is your commitment as a country towards the construction of this lab?
Honorable Minister.
Thank you very much, Honorable Member for Central Badibu. The construction of a functional quality control lab, of course, we are all aware that this costs a lot of money. Preliminary findings reveal that it will cost nothing less than $7 million US, and this could not be fit, could not fit really in the budget. So we had to discuss with partners, which we had been doing well before now. Anytime we had the opportunity, we mentioned it. We mentioned it to One Health before, last year, 2 years ago. We mentioned it to West African Health Organization, equally to get the support. Sadly, we had the AKI issue, but World Bank came in at that point, at that juncture, to say they could support. So World Bank is funding it entirely. Government is not contributing financially to it. Government has already provided the land in Brusubi, and the World Bank is paying for the services of a health planner, and that they have already done the initial planning of the facility, and then an architect is also drawing the facility, and the recruitment process for the people who are going to construct the facility is ongoing as we speak to you. And this facility, since we also do not have a food quality lab in this country, we said it's an opportunity to join the two, so that we do not have a challenge with food products also in the future. Unfortunately, World Bank listened to us, so the lab is going to be a food and drug quality assurance lab for this country. Thank you very much.
Thank you. Member for Woolly East.
Thank you very much, Honorable Speaker. Honorable Speaker, in your point 16, which is dealing with increasing personnel, which is not approved in this budget, but we expect you to put it in the next budget so that we can approve that. That is a welcome one. But my question is, you said the ban on the maiden pharmaceuticals is ongoing, but our recommendation is to ban them permanently. Is that the same as what we are saying? We want permanently to be there, not ongoing. Because maiden pharmaceuticals problems throughout the world is very glaring. In Indonesia, in other places, so many places, they are killing people through this medicine. So we don't want maiden here anymore.
Thank you very much. The intention was, the statement was intended to convey that message, that it is a permanent ban. Yeah. Thank you.
Member for Fonye Councillor.
All right, thank you very much, Honorable Speaker. Honorable Minister, if we may be guided, it seems, as per the act of the MCA, insinuated that they have the powers to do without the influence of the ministry. But in the other end, you're also saying that the Ministry of Health is also working to review. So we want clarity here. What are you talking about? Thank you.
Thank you very much. The act, what I was trying to say was the act, the components of the act give the authority to the MCA to carry out certain functions that they are mandated to do. Now, when it comes to review of policies, documents, review of acts, the ministry has a role to play. And certainly we're working with MCA and other stakeholders. It's not just MCA and the National Assembly itself in consultation. So this, because it is cross-cutting, So we are doing it in consultation with other agencies as well. But the ministry has a role to play in the enactment of laws. The bills will come from the ministry, and then after consultation with the assembly, and eventually it will be presented here for it to be passed into law. It even has to also go through to cabinet for cabinet to look at it and also have an input and agree to what is being discussed. That's what we said, we are reviewing them. So for that review, we thought it's important to have a desk review because too often than not, if they are done in isolation, sometimes there are overlaps of functions. So that is why it's important to have a look at all the acts that are available so that there's no overlap of functions. So that review, World Bank is supporting the process, and a law firm has already been engaged to do a desk review for those, and then they will come up with recommendations with the participation of various stakeholders, including MCA, and then the Ministry of Health, and then we'll come up with what to present to Cabinet, then to the Assembly. Yeah.
Member for Combo South.
Thank you very much, Honorable Speaker. Honorable Speaker, I have a series of questions. Maybe the Minister had to jot them down, about 4 questions, so that we not be going backward and forward to answer them. Is that okay?
You come again?
Yeah?
You come again?
I said I have 4 questions for the Minister, so that I'll do all the 4 once, and then he can just answer them.
Please go ahead.
Rather than asking one question and sit down again and come back again. Okay, thank you. Thank you, Honorable Minister, for coming. I think we really appreciate, and these are some of the things that we need to do. You talked about your response to number 6. I have a question, is how long do you think that is going to take? And another important thing that you talked about is the operationalization and also the revitalization of the primary healthcare systems in the Gambia. I think it is important that we are given an update on that and some of the strategies that you have in place so that it can be an information sharing, and then we'll be able to do our work at the ground to ensure that this thing comes back, which is very key in our healthcare system. Honorable Minister, you also talk about the operationalization of the health insurance program. I think we need an update on that because it's been a grapevine in the country. We need to know the strategies that you are doing in place and also its recruitment processes and how far have you gone in the establishment of the secretariat and also its operationalization. Honorable Minister, my final one is that is on 26. You talked about your response. We want to know the number of, what are the timelines? What are the timelines for the implementation of those programs, and how soon are they going to do, and what will be your process in updating the National Assembly, especially the Health Committee, to know those timelines? Thank you very much, Honorable Speaker.
Thank you. Thank you very much. Thank you very much, Member for Combo South. With regards to number 6, the response is that the Ministry of Justice is actually already looking at the reports, and then will advise on the way forward with regards to the suggestion or the recommendation by the committee to pursue legal action against Maiden Pharmaceuticals for exporting contaminated drugs to the Gambia. So the Ministry of Justice is actually reviewing that. And I think I can say at this juncture that already he's in touch with a world-renowned law firm that has expertise with these kind of issues. The engagements have already started, and series of meetings have started with regards to what to do next. So they are putting forward, a strong team to look into this. But however, subsequent actions that will take place are awaiting the submission of the report of the government inquiry to the government. As soon as those report comes, then the further actions will be taken care of. Now, I think by extension, it's a similar thing on 26, if I could continue, because it talks about the timelines. We are expecting that report very soon. In fact, what we are told is within it's difficult to say since it's not under our control, but we've been given assurance that it wouldn't take time for us to get that report. And that report will make some of those recommendations, we believe, and then we'll take action, government will take action appropriately. Now, with regards to the operationalization of the primary health care, it's actually inherent in government strategy for the provision of universal health coverage, because we believe it's going to be very difficult for us to attain universal health coverage without strengthening primary health care in the country. So primary health care is very pivotal in our overall strategy. Already, stakeholders have met a couple of years ago, and a document has been produced, which is a costed document, which is titled The Revitalization of Primary Healthcare in the Country. So some steps have been taken. However, the financial constraints, the funding constraints are the main issue why it is not being rolled out, because it also requires employing more people, more community health workers in the communities. But the government intends to ensure that all the about 2,000 villages and towns in this country become key primary healthcare villages, because it's only about half, a little less than half, that are key primary healthcare villages in the country. But with the benefit that is derived from having those people in the communities, those people that people could run to with minor ailments, they could detect a whole lot of things. They could tell people when there are danger signs for them to go to the health facilities. We believe there shouldn't be a key or non-key village. All villages should be key villages, because if one village benefits from it, then certainly the other village can equally benefit from it. So this is our strategy. At another level, we have put this forward in a meeting with the United States partners. The United States Secretary was there, and we said as a country priority, revitalization of primary health care is very high on our agenda, and they did promise that they're going to look at it to see how they can support that process.
Thank you.
The health insurance, as we know, what was going on was the registration for the health insurance scheme. But at the same time, knowing that we also needed to get for the citizens an electronic birth registration or electronic birth certificate, we thought it wise to do it together. And I'm sure you'll all agree with us that it is time-saving, and it has cut the cost drastically, the fact that we did the two together. Otherwise, one would have had to do one and then go and spend almost the same amount of resources to do the other. And as we speak, over 1 million Gambians have already been registered, have gotten their health insurance card and also the birth certificate. Now, that is the registration. The enrollment proper, the targeted date is June of this year. That is, so the team, the insurance authority, which has already been established, is actually now trying to mobilize funds to ensure that the insurance fund also has the funds that are in there. So they are talking to partners. Now, the last time there was a meeting with our select committee for health, to see, and the finance minister as well was summoned here with all of us to see how we could, ensure that the funds are available for the operationalization of the health insurance come June. World Bank equally wants to support, we have been told, but their support is actually dependent on government putting in resources first, because otherwise they said they would not come on board. So we are hoping that happens, but the targeted date for operationalization is June of this year, inshallah. The authority has been established already. There is a health insurance board, and then there is a health insurance authority. They have a CEO, and they are now in the process of recruiting other portfolio holders in the agency. So they are now building their staff pool together. They are temporarily housed at the Medical and Dental Council building along the Battle Harding Way. So they have structures now, and they are expanding those structures. I hope I've answered everything.
Thank you.
Yes, sir. Thank you, sir. Yeah.
Honorable Minister, thank you. Member for Janjamure.
Thank you very much, Honorable Speaker. And Honorable Minister, thank you very much for your responses. But then, if I may ask from question number 26 with your response, what I want to establish here is what are the state of the surviving children that the ministry were following up with? What are their state? And also, from your situational report, which is the 2023 March situational report of Ministry of Health, I think you did report of 2 other cases. And if it is true, can you kindly buttress on it, please? Thank you.
Okay. Thank you very much. The surviving children are still being followed up. They've been going to the health facilities to be seen, Edward Francis Small Teaching Hospital and the Medical Research Council. Now, there is, they have a coordinator, who, Mr. Sanya, who has been very, very supportive, who is in touch with all of us, including myself, and the Director for Health Services, and is equally in touch with the families of the surviving children and the other families of the deceased children as well. And he facilitates each time they are supposed to go for treatment or for follow-up. He coordinates it, and he has access to I myself. He calls me, and we communicate, and I myself follow up their welfare with regards to treatment. So that is happening. And equally speaking, the member for Banjul North, who is also been quite active, we all communicate to follow up the issue of the surviving children. The second question was what again?
Honourable Minister?
Yes, the 2 cases, yes.
What?
Yes.
What was the second? Honourable Minister, please.
Yes, sir.
What was the second question?
Honorable Speaker, do you want me to come back?
The second question. Minister is not, maybe he must have forgotten.
The second question is on the situational report for March 2023. It has been reported that there were 2 cases of AKI. I just want you to enlighten us about the new 2 cases that are reported.
Honourable Member, is that part of the Minister's statement?
Honorable Speaker, if you look at his response on number 26, he did reported about the survival of some children and that the ministry are following up with. And as such, I definitely think it is also important to link my question to his response. Thank you.
No, Honourable Member, that one is not part of the Minister's statement. Sorry about that.
Honorable Speaker, I think it is, because looking at his response, he talked about children that actually survived from the AKI. And also looking at the situational report of Ministry of Health, it is clearly reported that there are 2 new cases that have been reported. So why can't he really give us a response as a parliament?
No, honorable member. No, that's not part of his statement. The member for Banjul Central.
No, I just want to also appeal to you by using your discretion, because
Yes,
if you,
sorry. Yes, sorry. Banjul Central first.
Thank you, Honorable Speaker. Honorable Minister, with regards to number 22, which says that all medicine products should be subjected to screening before release into the market for distribution until the tail end. And from the response, it said that this is currently a big challenge for most countries, and that the WHO recommends random sampling and testing of 5 to 10% of products. What are the current mechanisms we are using at our discretion with the available resources that we have currently in terms of the sampling aspect? What are the procedural settings that are currently under?
Thank you very much. Actually, the standard practice and based on WHO recommendation, the information we got and what has been happening, what we also know, is actually that you can hardly find any country that tests 100% of the products that come into the country. This is what happens. However, most countries do what is called risk-based testing and regular random sampling. When they do regular random sampling, because they go into the communities unannounced and they go and pick any sample, any drug sample and test, that keeps people on their toes because they don't know when the regulators are going to come. They equally do not know what sample is going to be selected. So for that reason, everybody will try to ensure that the products are safe to the best of their ability. But of course, product safety is not only dependent on the people who are distributing it. In fact, most of it probably depends on where it is manufactured from. So this is the standard. Now, when we had this very difficult incident in the Gambia, we thought we even needed to be more aggressive. Then we asked the WHO for help to test, in fact, all the syrups for us in this country and other medications for us in this country. And samples were taken, over 100 samples have already been taken and sent outside for testing. And the results have come for most of them, and we still continuing to do that. So this has been our strategy. Now, for our government-imported medicines, in fact, we decided that everything should be tested, 100%. It is difficult because some of the medicines, we need them, they are in country, but we are waiting for test results because we just think that this was a very bad experience for our country, and we don't want to see any repeat of this. So that is what is happening now. But it is difficult, I must say. Apart from the cost, the testing process itself takes time in the laboratories. And these labs were also not there just waiting to receive samples from the Gambia. They are doing it for their own local market in their country. They are doing it probably for other countries because they are WHO accredited labs. So it is difficult when they get this huge number of samples from the Gambia to process them all at the same time that we want them. So we put a lot of pressure on them to ensure that they get it done. But certain things take actually, by nature of the way they are done. Sorry, sir?
Honorable Minister, I suggest that you summarize. We have about 15 more members who wish to question, and we have only 30 minutes to go.
Thank you, Mr. Speaker. Yeah, so by nature of the processes, because they have to follow the standard processes, test for one, when they see something, they follow it up and follow it about something. If they don't see, they also continue to test for others. Thank you very much. Yeah.
Point of order.
Member for Fonyi Binta.
Point of order.
Point of order.
Yes.
From the member for Central Baribo, can we hear that point of order?
Point of order 48, clause 6.
Yes, 48 clause
After a statement has been delivered in the assembly, a period of questions on the statement, which shall last no more than 1 hour, may then ensue. The speaker shall determine the period taken into consideration, the content of the statement, the number of members wishing to ask questions, and the pressure of other business. What the honorable member of Janjambure asked was 2 Akai cases that were reported. So he asked the minister to make clarification on that. It's connected to 26 of the statement. The government should provide compensation to the families of deceased and surviving children. So he wants the minister to tell the House whether that too is part of it or not. So they are connected.
No, honorable member, you are wrong.
I'm wrong. I'm out of order, but I'm not wrong.
You are out of order. Honorable member, thank you. Honorable member, you are out of order. The member for Fonyi Binta.
Thank you so very much, Honorable Speaker. Honorable Minister, referring to number 6, the government should consider pursuing legal actions against Medin Pharmaceutical for exporting contaminated drugs into the Gambia. And now looking at the response says the Ministry of Justice is already looking at the report for advice on the way forward. Looking at for how long? Now, since December, if I can remember the last session that we had, January, February, did they have a problem in their vision or what is happening? Can you tell us, please?
Thank you very much. As I mentioned earlier, we are all aware that the government set up a committee of inquiry into the issues. And the report of that committee is being awaited as well. Government has gotten the report of the National Assembly Select Committee for Health, which is what we are discussing today. Government is also waiting for the other one to look at their findings, which may also add value to what is going to take place. Typically, without some further information, it will be even difficult to pursue legal action. So you certainly need some basic information, which would have been a collation of all the findings from the various reports that will give a legal ground for the pursuance of any legal route. So this is what is happening. Now, when that entity will submit their report, I certainly do not know. But from the indications we had from people, that probably they will do so soon. This is what we had. Yeah. Thank you.
Member for Joshua.
Thank you very much, Honorable Speaker, and thank you very much, Honorable Minister. On document number 23, and in your response with regards to the QC test that will be borne by the importer, my question is it currently happening? If no, when will we start? And also, will be responsible of the monitoring aspect of it?
Sorry, kindly repeat that.
On the QC test that will to be borne by the importer.
Yes.
Is it currently happening?
Yes.
Are they currently borne the cost of the test? If no, when will it start? And also, who is responsible of the monitoring aspect of it? Because if it is sent for testing, are they going to be responsible, or the government is responsible to monitor whether they did the proper test?
Yeah, so the QC tests are continuing, and the registration processes are continuing. But of course, the volumes are large. You remember there was a time that there was a lot of outcry that the MCA quarantined a lot of drugs, and they insisted on those drugs being tested. So the QC test is going on still, and the importers are bearing the cost. However, they are complaining. In fact, just before I came in yesterday, we received a written letter, a letter from copied to us, written to MCA by a lawyer of one of the importers with regards to those kinds of stringent measures, indicating that they'll be detrimental to the smooth flow of medications. They may end up causing a rise in the cost of the medicines, because eventually they will add all that to the cost of the medicines and so on and so forth. But it's still going on. And that of the government drugs, government is paying for them. So Ministry of Finance is supporting us to pay for the government, the drugs that are imported for government. Yeah. I don't know if I've answered fully.
Thank you. Member for Lower Fuladu West.
No? Yes.
Minister, please. Member for Lower Fuladu West. Member for Banjul North.
Thank you very much, Honorable Speaker. Thank you very much, Honorable Minister, for fulfilling Standing Order 100, subsection 1. Honorable Speaker, I will refer you to section or to respond 26, number 26 of the response by the Honorable Minister that talks about the surviving children. Even though my comrade have asked a question, but I will ask a different one. I will want to know, Honorable Minister, whether as far as
a different one on his statement?
Different from what?
No, it must be on the statement.
No, it is on the statement I'm talking about. Yeah. So what I want to know is, as part of the surviving children, do we have any critical situation whereby it will require any overseas treatment? If yes, what is your ministry willing to do as far as that situation is concerned? Within the response also, you talk about pending report of the inquiries set up by the government. When are you expecting this report? Because as we all understand currently, when it comes to the victims, it is very important for the government to do something as far as the compensation is concerned.
Honorable, please don't make statement. Just stop at the question.
Yeah,
those two questions.
Can you please allow me, Honorable?
Yeah, please. Those two questions will suffice. Please.
Okay, fine. So, like I said, if there is any critical situation by the surviving children, if there is any case, what is your ministry willing to do as far as helping them to go for overseas treatment, as far as their situation is concerned? The other one has to do with the submission of the report by the government. How soon can we expect this? Thank you.
Yeah, thank you very much, Honorable Member. With regards to the surviving children, they are being followed up, and if any of them happens to need treatment that is not available here, it will be taken up, and then the government will do the best to ensure that the person gets treatment anywhere that is feasible, including outside the country. Yes. Overseas treatment, yes. Yes. The second question, with regards to the report, we've been told the report will be ready soon. This is an independent committee. We don't have any control over them. Their work is independent. So it's difficult to say that they are going to be ready this week or next week. All we've been told is soon it will be ready. And we're actually all looking forward to the report, so we know what to do next. But inshallah, it will be made available soon. Thank you.
Member for Brikama North and Minority Leader.
Thank you very much, Honorable Speaker. Honorable Minister, the heading of the report, you have at least 66 children died as a result of the HAI. Can you inform this assembly precisely the actual number of children that have died so far? And in the report, one of the response, again on the surviving children, can you inform this August Assembly the number of surviving children that are currently receiving or undergoing treatment?
Honorable, I want to limit it to two. Because of, yes, time, we have time constraint.
Well, these are not that very statement. Government is reviewing the reports. Allow this one. Government is reviewing the reports. Week report beside the report of the committee. Which other reports is the government reviewing?
Yeah, thank you very much, member for Brikama North. Now, with regards to the AKI statistics, cumulatively, there are 130 cases now, but these are categorized based on the case definitions. So 84 are confirmed AKI cases, and 6 are probable cases, and 40 are suspected cases with all various definitions. Now, with regards to the confirmed deaths total 72. Now, that's a case fatality rate of 85.7. This is with regards to the statistics. Now, of course, when there is an AKI admission or an AKI mortality, we had said here in this August Assembly that acute kidney injury has multitudes of causes. AKI was happening well before this serious episode of AKI. AKI is a clinical condition that people get. Some of them acquire it in health facilities whilst they are there naturally because of one other problem or the other. Some are categorized as community-acquired acute kidney injury cases. So AKI has been a known disease well before now. What that means is that we are still likely to see AKI cases as part of the disease entities, just as we see malaria, we see tuberculosis and others. But is it part of this cohort of cases that we are looking at? That we cannot determine until we go ahead to do further investigations. I think this is the answer to that. When we say the Ministry of Justice is looking at the reports, we are looking at this document is available to them. We had presented to Ministry of to the Cabinet various presentations. So they are looking into all the information that is available so that they can come up with what we want to get.
Minister, I think maybe you've not heard him clearly.
Yes, I said government is reviewing the reports on page 8, where you have the response. Government is reviewing the reports. I say, beside the report of the committee, which other report or reports is the government reviewing?
Which question is it again?
Minister, you know, in your response.
Page 8.
Yes.
On top.
Yes.
In your response, you
26.
indicated that
The response to 26.
Yes.
indicated that government is
Yeah.
reviewing the reports. So which reports he is
Yes,
asking
so-
beside the National Assembly's Select Committee's report?
So the government is looking at the Ministry of Finance, Ministry of Justice. The government is reviewing reports. Okay, so I've got it now. The government is looking at this report. The government is looking at the presentation we made to the cabinet, and also the causality report that's submitted by the WHO. So government is looking at that, and the government is now waiting, I believe, for this report of the inquiry into the AKI issue, so that all these things are put together to come out with a government position on the issue.
On the same issue?
Last one is the number of surviving children currently receiving treatment.
Survivors. What about? Okay. The total number, I think I was informed of 3. We were seeing 3 of them. I can be corrected if my team is here, but we've been seeing 3. 3 are being seen by the health workers in EFSTH and then the MRC. I think one goes to the MRC for treatment on a regular basis. It's coordinated by Mr. Sanyang, their representative, and also the member for Banjul North has been very instrumental. He's been in touch with us, also supporting their issues, and I myself, my team, have been facilitating that. Thank you. Now, but as we say, when we talk about survivors in such, and we have a large number of 130 being cumulative cases, and then we have 40 suspected cases and 6 probable cases. What that typically means is, apart from the 72, all these ones are survivors or probable survivors, because they were probable cases and some were suspected cases. So in the real sense, they could also have survived the AKI. This is what it means. That's why I gave you the total number being 130 and the 72 being the mortality. But of course, if you go, typically the people who have been followed up now are these 3 people that I'm aware of that have been seen by the doctors. Yeah, thank you.
Member for Parliamentary.
Thank you very much, Honorable Speaker, and thank you very much, the Honorable Minister of Health. With reference to your question or your response to number 4, which is the university has already agreed to process and World Bank is ready to support the process. The postgraduate committee at Edward Francis Teaching Hospital has been supporting in the process. On what basis is the World Bank ready to support this?
Thank you very much, Honorable Member. What we are trying to say is the establishment of a school of pharmacy in this country is long overdue. Probably that contributes to the challenges we have with the very scarce number of pharmacists in this country. Now, the World Bank has been instrumental in supporting our postgraduate studies in the Edward Francis Small Teaching Hospital. So what the bank has done for us is recruiting the faculty members. So as we speak to you, the World Bank is paying for, I think, 16 very senior consultants, very senior doctors and professors who are brought from the sub-region, mainly Ghana and Nigeria, and they are all working at the Edward Francis Small Teaching Hospital here. And it has been very beneficial, I must tell this August gathering, because these are high-level doctors who are providing services to Gambians here, but equally speaking, they are providing, they are also training the young doctors. On the side of the nurses, they are supporting us, they are paying for the tuition of nurses who are specializing in anesthesia, equally speaking, nurses who are specializing in perioperative nursing and pediatrics, because we want our nurses to specialize. So with this background, we approach World Bank again, that if the country has such a problem of not more than 25 pharmacists, qualified pharmacists for the whole country, we also need a school of pharmacy, and they are willing to support it in a similar vein as they are supporting the other ones that I have just mentioned.
Thank you.
And this we have to do in conjunction with the university and the medical school. Yeah.
Thank you, Honorable Minister.
Yes, thank you very much, Honorable Speaker. I have another question. I have to.
Please.
Can you please allow me to
Please,
ask three?
please. We have 10 minutes to go, and we.
Can I ask one more then?
I still have about 6 more on my list. Please, 10 minutes. We have 6 more.
Can I ask one more, if not?
I
three,
apologize.
please? Sorry?
I apologize, please.
Thank you.
Member for Fonyi Jarol.
Thank you, Honorable Speaker. And Honorable Minister, let me refer you to recommendation 10. And I read that government to equip the hospitals with required medical products, supplies for the effective and efficient management of patients. And in your response, this is an ongoing process. The new health insurance scheme will help to enhance this with other support from government and its partners. I don't know if the common complaint by people if you visit health centers, health posts, or hospitals is there are inadequate drugs or shortages of drugs. This is a common complaint by all patients who visit hospitals. I don't know what is your take in that, and then what are the challenges you are facing?
Availability of drugs in health.
Drugs in hospitals. There is always shortages. People complain of shortage of drugs in
Is that
hospitals.
part of his statement?
Huh? Pardon?
Part of his statement?
Yes, he said it's an ongoing process to equip it. The supply is an ongoing process of drugs to hospitals.
For
But
the
people are complaining.
For the AKI?
No, I mean, look at 10. Recommendation 10.
Okay. Minister, please respond. And I suggest that you summarize. Time is increasingly of the essence.
Okay, thank you very much. Honorable Member, thank you for that question. I think from the starting point, what we spend on health care as a country is grossly inadequate. From the beginning, we know that what is allocated for the procurement of drugs will certainly lead to shortage at some point during the year before the next allocation. That is clear, because what is recommended for essential drug supply is at least $2 per person per annum. And in Gambia, what we spend is not even up to $1 per person per annum. So that's from the onset, we know that there's going to be shortage. Healthcare is very expensive. And I keep on saying the human body is the same as it is in the Gambia, as it is in the UK, as it is in New York, and so on. But we see what those facilities, those hospitals, those countries spend in one health facility. Sometimes what they send in one health facility, one big hospital, is much more than our entire national budget for health, what those countries spend in one facility. So how can we make ours like those ones? It's going to be very difficult. However, with the meager resources, we think if we manage prudently, we'll be able to provide the drugs. But I think availability of drugs has to go beyond the resources alone. The procurement process of drugs in this country is very cumbersome. Now, each year there is a quantification process what we are likely to need. We know the budget says this is what we have. We have quantified this. It's more than what we need, but this is what we have. And the tenders are floated. Advertisements take place for a period. When that happens, people show interest, bids are evaluated. When the bids are evaluated, then a winner is selected, a standstill period, then he is given time to supply. From what I have seen, sometimes people bid and they don't have the capacity. But unfortunately, they are said to be the winner. GPPA rules are followed and they are the winner. And GPPA insists that they have to be given the contract. But they don't have capacity. And as time goes on, those things surface. But of course, these drugs also have to be manufactured from other countries after these people have won the bids. Then they package them, they ship them. So a lot of times there are delays in shipment and so on and so forth. The current challenges we had because of the COVID-19 pandemic, every now and then the supplier will say the shipment got late, there were no containers. That time that there was container shortage worldwide, that time that there was shipping delay. So this past year has been very, very difficult. It has been one of the most difficult periods for drug supplies in the country because of these things that I've enumerated.
Thank you.
So I think we need to revamp the whole supply chain mechanism for drugs in this country.
Thank you. Member for Bundu Kapunda.
Honorable Speaker, but I have one urgent thing just to add to this, if I may.
Yeah, go ahead, Minister.
Yes. You see, but to make that all, to lessen the impact, the World Bank is also supporting again, and the Gambia government is giving little support there, counterpart funding. The World Bank has this results-based financing, and this results-based financing has been very instrumental. Each quarter, each of our health facilities is scored, and then they are paid an amount of money. And then 40% of that is for the staff to share as bonuses. 60% is for the renovation of the health facility and procurement of drugs. So this is very useful, but my appeal is you also add your weight in helping us ensure that these facilities also put this to good use. Yes, we are doing our best with monitoring, but being assembly members from those regions, I think it will also add value if you support. I'll give you an example. One of the quarters, Brikama here, got up to $4.2 million to spend in this way. So I don't think there should be any reason why Brikama, you should go there and the toilets are not working and the rooms are not painted. And some of these basic drugs are not available. So, member for Brikama North and South, these are some of the things. So we'll be sharing this information with you so that you can also help us following up what goes into the health facilities in your communities.
Thank you. Yeah. Thank you, Minister.
Thank you.
The member for Bundu Kapunda.
Thank you very much, Honorable Speaker. I think I also want to ask almost the same question, point number 10, but I have to reframe it. Basically, as we know, medical product and supplies is for the effective and efficient management of patients. So what is the current status of the medical product and supply in our public hospitals, please? Thank you.
Yeah. Thank you very much. So as we speak, quite a lot of drugs are available. There are some gaps still, but quite a number of consignments have also been received, and they are awaiting distribution, but they are actually being tested. So what we are trying to do is to expedite the testing process, because we don't want any drug to get into the system that has problems.
Thank you.
I think we have all, as a country, gone through enough problems, so that is why. The last time we had a lot of normal saline, that is the drip, the mainly used one, but we insisted that they all get tested, and fortunately they got tested and they are free. they are safe for use, and they are being distributed. So this is why there is some delay. But the RBF, unfortunately, this resource-based financing, which used to be in the provinces from Kalaji, the Western region was not getting it at all, West Coast. But fortunately, we've included them getting this RBF for all the facilities. I think that is a big plus, yeah.
Thank you, Honorable Minister. Now, last, I will give the floor to the member for Fonyi Prefect.
Thank you, Honorable Speaker. Honorable Minister, let me refer you back to the response of question number 10. Honorable Minister, are you telling us that the new health insurance scheme enhances the supply of medical products for patient management? What is the relationship between the health insurance scheme and hospital equipment, as well as medicine?
Okay. Thank you very much. So the way the health insurance scheme is going to operate, the hospitals will be enrolled. For example, if we say Edward Francis Small Teaching Hospital, the insurance authority will ensure that they are able to provide these quality services that they say they are going to. So in fact, it's going to be competitive. There has to be standards that are supposed to be maintained. And the insurance will have people, quality control officers, whose role is to ensure that standards are there. The hospitals are clean enough. The patients are seen on time, and so on and so forth. And they are all equipped for the function they are supposed to perform. If it's a teaching hospital, if it's a minor health center, if it's a major health center, and that their lab is functioning, and then they have the drugs. They will provide services. For example, they treat a patient gets to the hospital and then has symptoms of malaria. The patient sees the doctor, then they prescribe for the patient. He goes to the lab as well, then they prescribe. All that will be put into a bill. The hospital will now send this bill to the insurance authority, and the insurance authority will reimburse the hospital. So the fact that the hospitals will have direct access to those funds for drugs, then they are forced to buy drugs, because it will not be part of the insurance scheme. And the insurance, everybody wants to be part of the insurance scheme. So they are going to ensure that there are checks and balances, so that service provision is available. And the fact that insurance will pay for even a tablet of paracetamol that is issued out to a patient, then there's no basis for shortage of paracetamol in that facility. This is how it will help us. Yeah. Good. Thank you.
Thank you very much, Honorable Minister. I want to thank you sincerely for coming to reply to the report and to answering questions from honorable members. I equally want to thank members of the National Assembly who asked questions and for their participation. Thank you very much, Honorable Minister. Thank you. Clerk, we may proceed.
Orders 74 and 75, third reading of the Mutual Legal Assistance in Criminal Matters Bill 2023 by the Honorable Attorney General and Minister for Justice.
Honorable members will recall that the consideration stage of the Mutual Legal Assistance in Criminal Matters Bill 2023 was concluded on Thursday, 23rd March 2023. Accordingly, today is appointed for the third reading in accordance with Order 75. Therefore, I will invite the Honorable Attorney General and Minister for Justice to move a motion for the third reading of the bill entitled Mutual Legal Assistance in Criminal Matters Bill 2023. Honorable Minister.
Thank you, Honorable Speaker. Honorable Speaker, I move that the Mutual Assistance in Criminal Matters Bill 2023, having gone through consideration stage, be read the third time. I move. Thank you.
Any seconder? Or Wuli is?
Thank you very much, Honorable Speaker. I rise to second the motion. Thank you.
Honorable members, it has been moved and seconded that the bill entitled the Mutual Legal Assistance in Criminal Matters Bill 2023, having gone through the consideration stage with amendments, be read a third time and passed. Those in favor, please say aye. Those not in favor, please say no. The ayes have it. Clerk.
Order 72, continuation on the consideration stage of the Anti-Corruption Bill 2019 by the Honorable Attorney General and Minister for Justice.
Thank you, Clerk. Honorable members, the mutual legal assistance in criminal matters bill has now passed. Honorable members, it is almost 1:30. Clerk, please.
Sorry. Mutual legal assistance in criminal matters bill 2023.
The bill is deemed to have been read a third time and passed. Clerk.
Order 72, continuation of the consideration stage on the Anti-Corruption Bill 2019 by the Honorable Attorney General and Minister for Justice.
I'm not sure, it is now 1:20, whether we can break off briefly for prayers and come back so that when we start, we will.
Please,
so that, because what I want to avoid, once the House is suspended, once the House is resolved to the Committee of Stages, we'll just continue. We'll not have. Please, the House now suspended until the House now suspended until 2:15. Honorable members will recall that the consideration stage of the we recall that the consideration stage of the Anti-Corruption Bill 2023 began yesterday. However, the Assembly could not complete the process. We will therefore continue today from where we stopped.
Honorable Speaker.
Who is that?
Minister Tiende.
During the consideration stage, members shall have the opportunity to give detailed consideration and scrutiny to every clause and schedule in the bill. This stage also provides the first opportunity for amendment to the bill to be debated and voted on. I will now therefore resolve the Assembly in the Committee of the whole House, into the whole Assembly to give consideration to the said bill, that is the Anti-Corruption Bill 2023. Resolves into the Committee of the whole House.
Is where I was observing you. The minister is not around. Honorable Chair. Honorable Chair.
Yes, Honorable Member for Lower Salem. Member for Lower Salem, please go ahead.
The minister is not around, and we are waiting for the minister to come in. And
come again.
yes, I said the minister is not around, but not yet in the chamber. So we have to wait.
He's here.
Okay, he's around there. Then withdraw.
That is here. This proposal clause non-stand those in order. So right now, it's legally, we have now resolved the committee to consider it. And then the name from where we stop.
The Assembly now resolves into the Committee of the whole Assembly to look at the Anti-Corruption Bill from where we stopped yesterday. And I think we stopped at clause 3.
We proceeding to 4 now.
No, yeah, we stopped at 3 yesterday. So we are proceeding to clause 4 today.
Clause 2. Suleiman. Clause 4, tenure of office.
Clause 4, tenure of office. Or for Olyundum?
Yes, I have some proposals.
You submitted.
Chair, I think we need to follow this procedure. When a clause is made, we look at from what FPAC, if they have any recommendations so that others will contribute, that will help it, make it. Yes.
The chair said he have no issues. Member of Central Body, why are you insisting he has issues? The member. Or not, please ignore him.
Okay.
Member for Combo is?
Thank you very much, Chair. I have an objection on the subclause 3, where it states to say
3 of clause 4.
Clause 4, subclause 3, where it states to say the chairman and other members of the commission shall hold office. No, sorry, where it says the member of the commission may only be removed from office by the president on the recommendation of the vetting committee 4, ABC. Now, the vetting committee, here my objection is, does it require the entire membership or a portion of them, like 2/3 of the membership at least, in the event that it cannot get into the entire membership?
Now, clause 4 sub 3. It says a commission may only be removed from office by the president on the recommendation of the vetting committee 4. Infirmity of body or mind, serious misconduct, violation of the constitution, serious violation of any other law, or bankruptcy.
I'm referring here to the membership, the composition of that membership to qualify the recommendation.
Maybe when we get to the composition. We are in clause 4 now.
But it still has to state here in this subclause that the membership must be in their anonymity or a percentage of their membership.
Yeah, that is when we go to composition.
Let's consult the
No, because if you want to allow this, every clause we're going to go ahead.
Thank you, Honorable Speaker. The member is asking a pertinent question. It is the vetting committee that will do the recommendation. That is different from the committee you are going to see in subsection 4, 5, and 6. This one is only to recommend the removal. That is the committee that you dealt with yesterday. So this is saying that is the committee that will make a recommendation for removal. And that committee is not a standing committee, so which means if there is a need for this to be done, they have to be constituted. So probably the regulations will further say how this will be operationalized. Because the vetting committee are only needed during shortlisting of commissioners. After commissioners are shortlisted and the name comes to National Assembly for endorsement, once they are appointed, that vetting committee does not, they dissolved. So they only needed again if a vacancy occurs, you constitute them to look into. So only and when a commissioner is to be appointed, you will constitute a vetting committee. But it's not a standing committee that will continue to exist. So therefore, which means if a cause for removal arises, they have to be constituted again to consider that cause for removal. And if they agree with the cause, that is the beginning of the removal process. Then they will make the recommendation to the president. But subsequently, you will see downwards, another committee will be set up to be chaired by a judge and so on and so forth and so forth. But this is the starting point of the removal process. If there is any need for it, a vetting committee will be constituted again. Just like the way they are constituted for appointment, they should be constituted again for removal.
Thank you. Parliamentary.
Thank you very much, Honorable Chair. The question that I wanted to raise, I saw it in the section 4, rather, it's part of the clause, so there'll be no need of raising it again. Unless still with the tenure of office, the section 4, where we have the subsection 1, the chairperson shall hold office for a term of 5 years, and other members of the commission shall hold office for a term of 4 years, and they may both be reappointed for 1 more term. So I suggest if we can say they not exceeding 1 more term of 4 years. That's my suggestion.
Now, yeah, Kiang West.
Good. I want to make a follow-up on to what the minister has just talked about. That is for the removal of a commission member, for commission to be reconstituted in case of such situations arises. So is it really feasible that we need to remove 1 member and we go and reconstitute a commission, a vetting committee again to do the recommendation for the removal of a commission member? And what that would also require another processes, and such or some removals might require an immediate action, to remove a commissioner from the membership. So I don't know how that would take, because if we are to remove 1 person, we need to go and reconstitute a commission. If that person is been removed, we dissolve them again. Another person is to be removed, we constitute a commission again for the remove. I don't understand.
AG, he's still on 3. I think let's resolve sub 3 first. That's what I said. No, let's resolve sub 3 first. It comes first. Let's finish 3 first. AG?
I can deal with both. The concern for Humanitarian is adequately covered for in sub 1. Your concern is for them not to be given a renewal opportunity of more than once. But the language have catered for that. The extension is only for 1 more term.
Chair, can I come in, please?
Yes.
Chair, Honorable Chair.
Yes.
Yes, instead of, also the chairperson shall hold office for a term of 5 years. I suggest instead of 5 years, let it be 7 years, including members.
Well, that's a new proposal. I'll leave that to the members. Let me deal with sub 3, like the honorable member for Kiang. I don't know which of the Kiangs. West raised. It's not. It's not a commission. It's a committee. It's a committee. Of course, yes, exactly the way you said it. That's how it will happen. They are constituted as and when the need arises for appointment and for removal. But they don't decide on the removal. They like they did for appointment. They don't decide the appointment. They receive applicants, list of applicants. They do a short list. And that's where the process begins, then it goes through other processes. For removal also, if there is a complaint or petition or a need to remove a commissioner, the same vetting committee will constitute, review it, and then probably if there is no need for the removal to go beyond that level, in fact, they wouldn't recommend. It will stop at their level. If they think there is good cause for removal, then they will allow the process then to go to an independent inquiry and so on and so forth until when the removal process is completed. But yes, the removal of even 1 commissioner will have to go through that process.
The tenure of the vetting committee, like to be clear, how long do they remain after the vetting process? When do we dissolve them?
The vetting committee, that's what I said earlier, it's not a standing committee. It's ad hoc. They are only called on when they are needed. When they finish a given task, they dissolve. Because these are not employees of the commission. It's like you said yesterday, it's a civil society member, it's a bar association member, it's a chamber of commerce member. So you only constitute them as and when the need arises to take care of a given task. Once they accomplish that task, they are no more needed until they are needed again.
What I'm trying to pursue is that in case a vetting committee do their work, and after the vetting process, somebody wants to contest that decision, their decisions. If someone feels to contest their decisions, for instance, I'm looking at to say, okay, 1 month after their mandate, the committee will be dissolved. So this will give a room to anybody within that 1 month to do whatever you need to do if you are not satisfied with the decision vetting committee.
The regulation will take care of those details.
Thank you.
Yes.
Thank you. The member for Lower Upper Salo. Member for Nyamena Dankunku. Then we move to the next.
Okay, thank you, Chair. My observation is on subclause 6, B, where you talk about where it is talking the committee appointed by.
Let's deal with 3 first, and I have proposal for 4. Then from 4 we go to 5, 6.
Okay.
I think 3 is clear.
Chair.
Yeah, I'll come to you. Yes,
Chair, thank you. I also support that proposal. We make it 7 years of 1 term. So once you serve for the 7 year, there is nothing like reappointment or giving you another chance. So we make it 7 years, you're done.
Okay. Member for Upper Salo.
Yes, thank you. For me, I think the way it is stated is better because you need continuity. If all of them leave at the same time, there is an issue of continuity in the commission. So it's always, that's why it's better to stagger them. Some go 5 years, some go 4 years. So which means at any one time, there is somebody who has actually, about knowledge about the commission. Yeah, institutional memory. Yeah.
Member for Busumbala.
Yes, Chair. Sub 3, members of commission may be removed from office by the president on the recommendation of the vetting committee. Here, I want to suggest that we maintain the same procedure of their appointments, wherein we include that the recommendation of the vetting committee and the removal of members by the president should be also subject to a parliamentary, yes, for the security of their office.
I'm not understanding. I can. Yes. I don't understand because here we are on clause 3. If
we are on clause 4, tenure of office.
No, we are on clause 4, sub 3. I want us to deal with sub 3 first.
Yes.
If your concern is
sub 3. That's what I read, in fact. A member of the commission may be...
Are you comfortable as it is?
No. I'm saying for us to adopt the procedure of the appointment of members subject to parliamentary approval. So the removal also, we should include it subject to the parliamentary approval so that,
Yes, his proposal is a member of the commission may only be removed from office by the president on the recommendation of the vetting committee, subject to approval of the National Assembly. Huh?
We can do away with the vetting committee now. We can do away with the vetting committee, and it may be read as the president. A member of the commission may only be removed from office by the president on the approval of, subject to the approval of the National Assembly.
But usually there should be a recommendation.
Huh?
There should be a recommendation for removal. Then that will be Attorney General, please.
Do you have, those of you who have been here for a while, because on top of my head I cannot recollect, do you have any legislation where the removal process of a public office holder have to come to National Assembly? I don't think that is best practice.
No.
Removals don't come here. All that we need to do to make sure that the removal goes through a fair process, an impartial committee be set up to investigate and establish the allegation. If it is a medical condition, there should be a medical board to confirm infirmity of body or mind. If it is misconduct, there must be a quasi-judicial review to confirm whether a misconduct was committed or not. But if all of those things also have to come here for every removal for approval, I've not seen it in any of our legislation so far for removal process to come to National Assembly.
And I think the National Assembly cannot probably take the role of the executive in removing, but yes. Nominated member Kebalang Fofana.
Thank you very much, Honorable Chair. Honorable Chair, I think the vetting committee is there for a purpose. And if you look at the composition of the vetting committee, it is there to serve as a neutrality line in the entire process. So I strongly believe their inclusion in both the appointment and determination should suffice. So, I mean, as it is. That's exactly what I'm trying to say.
Okay, thank you. Last, Ken West.
Honorable Chair, on situations where Parliament is not in the appointment process, we are not approving appointments, removals, we are not there too. Where the President is solely responsible on other bills, where the President is solely responsible for the appointments. When it comes to the removal, Parliament do not interfere because we are not involved in the appointment, so removal, we are not involved. So, but in this case, in the vetting committee is there and the President is still appointing, but it's still subjected to our approval. So it's important. So, but my submission would be, how is that removal going to be communicated to the Parliament now? Because we have put in somebody in office through our approval. If you are taking that person out of office, it should be to our no.
Yes, he will note that down. Brikama not.
Clarification. Well, this is just the act. The operation will be entailed in the regulations. So all what Honorable Member for Chair was saying, that is coming by way of regulations. Yeah, the detail.
Last, Banjul not.
Honorable Chair, I will just want to also concur with the Attorney General. I think it is important for us to see what is right because it has never happened here before. So it's important to put in place good practice and make sure that we allow the President to do the removal in consultation with the vetting committee.
Fonyi Jarol.
Yes, that's what I wanted to say, at least what the Justice Minister
Then thank
said.
you.
Yeah.
Thank you. Olyundu?
Yes, Honorable Chair, I think therefore we definitely need to rescind our earlier decision yesterday because on part 3, when the member for Brikama North with appointment, you remember he mentioned that Parliament will do in consultation with Public Service Commission with the approval of the National Assembly.
No. That's
what we are saying.
That's no, man. Now.
Okay. No, I just want to confirm that.
Now I think there's consensus on clause 3. Now we'll move to clause 4. Clause 4. Clause 4, sub 4. Now let's move to sub 4. Yes.
On sub 3.
On sub 3, to leave it as it is. Now, sub 5, I receive a proposal from the member for Olyundu. And he proposed new subsection 5. What we have on sub 5 is the President shall not remove a commissioner from office under subsection 3, B, C, or D unless he or she receive a report submitted by a committee appointed by the Chief Justice. Now the proposal from Olyundum read as thus. The President shall not remove a commissioner from office under
3, B, C, or D, unless he or she receives a report submitted by an independent committee which shall be chaired by a judge of the Court of Appeal who shall be appointed by the Chief Justice. That is the proposal from all Yundum to be appointed by the Chief Justice and will be a judge of the Court of Appeal. That is his proposal.
A judge of a court of
Honorable Chair,
second
I think it makes sense.
Yes.
He want to be specific.
Yes.
I think, yes, want to be specific. It makes sense.
Yes.
Specifically, not just...
No, please. Allow him to make...
I think the amendment is trying to...
Become an central body. Look this way. Go ahead.
I think the amendment is trying to be specific because the details here is just a committee. But who's going to head the committee? That's what I think it makes sense. If we agree that it's going to be a judge from the Court of Appeal,
exactly,
then it now narrows down to be very specific. I think it makes sense.
Now, the proposal from member for... No. All right. Member for Lower Salon, Upper Salon.
Yes, if you look at 5 itself, it's saying the president shall not remove a commissioner from the office under subsection 3B unless he or she receives a report submitted by a committee appointed by the Chief Justice. So what's the problem? This is appointed by the Chief Justice.
This proposal, Chairman Upper Salon, the proposal, member for Upper Salon, his proposal is report submitted by an independent committee which shall be chaired by a judge of the Court of Appeal. Now this one here is just saying
Chair, if you go further, you will see the committee.
No, they are not the same. Honorable Mbow is not the same. Look at your records. They are not the same.
Yeah. Okay. If you continue to 6. Huh? Under 6 is referring to subsection 5.
Chair, under 6, check 5 under 6. We have 5 under 6, and it's doing the same thing.
Member for Brikama North.
With care. You see here, the committee is already there. Whether you have independent there or you don't have independent, the committee is expected to be independent. Okay? So, and that committee is appointed by the Chief Justice. The composition of the committee is in sub-clause 5, 6. And here is headed by a chair who is a member of the Court of Appeal.
No, they are not. No, they are not the same. No, wait.
Yeah, it's headed by a chair.
You see, when you look at 5, it's submitted by a committee. They say the committee, the entire committee, appointed by the Chief Justice. That's what 5 is saying.
Yeah.
But for him, he's saying no, not the entire committee at 5. There's another proposal he submitted, but he said 5.
No, this is what I'm saying. But this is stronger.
Please.
I have not learned here.
Okay, all right, I'll come back to you.
Okay.
What the member is saying, when you look at clause 4, sub 5, it says, unless he or she receives a report submitted by a committee appointed by the Chief Justice. He is modifying it to say, unless submitted by an independent committee which shall be chaired. He said a chairman who shall be appointed by the Chief Justice from the Court of Appeal. That's where the no, please, honorable members. The difference is, they are similar, but there is different. The difference is, you are not the chair, please. The difference is, clause sub 5 is talking about the entire committee. But his proposal is saying that committee will submit both under clause, sub clause 5, only appointed by the chairman, the Chief Justice. That's what he is talking about. No, Birkama not continue. Birkama not.
I'm saying, Honorable Chair,
The suggestion is very hard, but not to
I am saying here, the committee is clearly spelled out. Whether you have independent there or not independent, is expected to be independent. So that's not important. And here, the composition is in 6. No, 6. It's in 6. And the composition is in 6. And is headed by a judge of the Court of Appeal. Yes.
Now let's allow the...
Are we not catching your eye?
Chair. Now, yes. Yes, please, the Attorney General.
I want to assist the debate. I think, Honorable Speaker, the proposal to change paragraph 5 of section or clause 4, clause 4, paragraph 5, the proposal to change it will not make sense because that will directly impact on 6. Unless you read both, if there is a proposal, you have to read 5 and 6 together. Because if you change 5 without letting the members know how that will affect 6, the debate will go on and people wouldn't understand what they're talking about. So because 5 and 6 have to be read together.
All right.
Yes.
All right. He submitted both 5 and 6. Let me read it together. His proposal to amend 5 and 6. 5 reads, the President shall not remove a commissioner from office under subsection 3B, C, or D unless he or she receives a report submitted by an independent committee which shall be chaired by a judge of the Court of Appeal who shall be appointed by the Chief Justice. And 6, the other members of the committee referred to under subsection 5 shall comprise 1 representative of the Gambia Bar with at least 10 years standing and a representative of civil society organization, both to be appointed by the minister.
Honorable Chair.
And also a judge of the Court of Appeal, who shall be the chair. The member for Upper Salon.
Chair, I think 5 and 6 must be read together to be meaningful. If you want to read 5 as a standalone, it's not going to make sense. But 5 and 6, what we have is actually the same thing with what he's talking about. It's just that it's done in a different way, but it's exactly the same thing. 5 and 6 must be read together. So what we have there actually satisfies what he wants. Because one, the Chief Justice is going to be appointing the judge from the Court of Appeal. And then the other committee members is from the Bar Association and the other one from the civil society. So it's the same thing. So what we have is the same thing.
What you have, when you read them together, they are all appointed by the Chief Justice. But what he have is the Court of Appeal to be appointed by the Chief Justice and also the representative of the civil society, from a bar, and also, yes, to be appointed by the minister. That's the difference.
No, you see what happened? A representative from the civil society.
Can you please set your eyes here, Chair? We are also having our task for a while now.
Janjamure.
Thank you very much, Chair. I think my observation here will really go to you. That is, if you can definitely allow us to debate on issues than actually making a verdict. And it seems your verdict seems to be actually siding with a particular group. I think, give us the chance, please. Thank you.
Member for Central Baribu.
Thank you, Chair. Chair, I also agree with him in other sense. If a member made a proposal and his proposal, other members have this opinion that is similar. Do you understand? Because the clause 6 that you read is stated here already. We have the judge of the Court of Appeal, we have the member of Bar Association, we have a representative of the civil society. So, but the first one, the first proposal, you know, we cannot have that one being amended. You remove the Chief Justice and say, who are you going to put it there? It will not make sense.
Member for Joshua.
Thank you very much, Chair. I think we have to look at this thing. I don't know whether what I am having here and what the minister is having is different. If you look at 5 and then you come to 6, under 6, you have 5 shall comprise a judge of the Court of Appeal, who shall be the chair. And then you come in this, all what he is claiming that under 5 shall comprise, that the composition of 5 shall be this. So that's very clear. So I mean, if you look at the composition of 5, it's telling you here A, B, C. All these 3 is telling you what is saying. So underneath 6, you have 5 shall comprise of A. And when the minister is having that, what we are having here, it is already clear here that 5 A is a judge of the Court of Appeal, member of the Gambia Bar Association, and then representative of the civil society. It's already here.
Before clarification, Central Badibu, you are fine.
Chair.
Upper Salum.
Yes. I think just to make a break, to break this thing, I think we can let Chief Justice appoint from the Court of Appeal, and then the minister then does the other 2 appointments. Then we move. Just like
Is.
Chair, the intention. I'm giving the floor.
Order.
Central Badibu.
Central Badibu. Order.
I'm giving the floor. I'm giving the floor. That's why the mic is on. Chair, the intention of these drafters is that is the Chief Justice that should appoint the committee. That is the objective here. So is it that we don't agree for the Chief Justice to do that, or we just want the Chief Justice to select only the judge?
That's his proposal.
That's his proposal.
Yes.
That only the Chief Justice, then we have to frame that so that we capture that.
Exactly, that's what he's saying. That's what he's saying, so that the balance the two between the executive and the judiciary.
Yeah, they'll bring their representative.
Have all these committees all appointed by by one organ or one person.
Yes.
That's what he's saying.
Yeah.
The spirit of this bill is...
Sorry.
Don't tell me. Don't.
Sorry. Member for Serekunda, please. I have not recognized you. Member for Lower Salum.
Yeah, thank you. Thank you, Honorable Chair. Honorable Chair, basically, you are not helping us with the minister. Our minister should help us. You know, the issue here is if boy, what why, please. No. Please, boy, are you the minister? I won't withdraw it.
Member for Central
I cannot boy. Be serious, why?
Order.
With who?
Proceed.
Order with who? Ask Suleiman.
Honorable
ask the member for Balibu. No.
Can you switch off your mic? Honorable member for Lower Salum, I said order so that they'll allow you to proceed. Please, member for Lower Salum, proceed.
No, what I'm saying here is these are not grammars. These are, I'll call it legal terms. You understand? The reason why you have your legal team down there, if members argue, bring them forward, they give you evidence. The minister is the same thing. The minister is not helping us at all.
No,
what I'm saying here is
to respond to you.
What I'm saying here is
to respond to you.
No, it's not respond to me. Please, Honorable Chair, allow me to come, please. You are just a presiding officer. Allow members to come. What I'm saying here is now.
Honorable, I am not just a presiding officer. Yeah, but not just. Can you withdraw that?
Just. Okay, I withdraw just.
Okay, proceed.
Chair.
No, what I'm saying here, Honorable Chair.
Chair, this member is wasting our time. Can
Chair.
we do something else, please?
Chair, this member is wasting our time. This member is wasting the time of the parliament.
Don't worry, they are young parliamentarians.
Contribution.
This is the works. Honorable Chair.
He's withdraw that.
Honorable Chair. The essence I'm saying is because the reason why you have your legal team and the minister, if we don't agree into terms, you consult your people. You understand? We leave it as it is, or then the proposed by the member. Then we go by that. Ask your legal teams.
I did that. You know what's their opinions that the proposal from the member for Oluyodo makes sense because what is in his proposal is on sub 5, clause 4 sub 5, to limit the Chief Justice appointing only the Court of Appeal judge. And then you have the minister appoint the civil society. And from that is what is. So now the member for Busumbala.
Thank you, Honorable Chair. Honorable Chair, thank you very much, Honorable Chair. Honorable Chair, we need to understand that this is anti-corruption bill. And most of corrupt practices we are trying to discourage happens in our government institutions, which the executive have a direct control. Please, please, we are making a law for posterity. Thank you.
For Combo South.
Thank you very much, Chair. I think it's important that we stick to as it is in the document. We cannot have 2 stages of appointment for a committee. No, let's leave the Chief Justice to do it, and then the rest will come as written in the text. Yeah.
Member for Sami.
One more time, Chair.
Member for Sami.
Thank you very much, Chair, for giving me the floor. Honorable Chair, I think we leave it as it is before we'll be, mixing things together. Let's leave it as it is, please.
Yeah. I can also come.
Member for Woodley East.
Chair, thank you very much. You know, the objective of this is that when you are dealing with a case like this, you cannot mix the two. Let's just accept the Chief Justice impartially creating a committee, because that's why they are going to the court. You know, it's the government. Most of this corruption, like he said, most of this corruption is taking place in the government. So if we are trying to curtail that and when we want a minister to appoint the committee, it may not be that impartial. So let's accept it as it is.
Now, this debate will continue until the next wall. We will not end. So now to separate the two is to go and vote. The member for Central Baribu says unless if there is tie in the voice. I come from Nyanija and I cannot measure or determine.
Honorable Chair. Honorable Chair.
Look, Honorable Chair.
No.
Honorable Chair. Honorable Chair.
No.
Honorable Chair, please. Honorable Chair, please.
Please don't use your mic. Don't use your mic, please. Okay, let me make this clear. Please. Minority. Yeah, please. The member for Nyamina Dankuku. Yes, I think the proposal from the member for Olyundum is for the Chief Justice to appoint. If you don't allow me, because we are going to conduct. We are going to vote now, please. Yeah, please allow me to proceed. No, you cannot. No, you cannot dictate me. No.
No, Honorable Chair.
Honorable Chair. Honorable Chair, you have to start with the parents.
No. Order. You cannot dictate me. You cannot
No.
direct me as to
No, but
which order. Please don't use your mic. Go and sit down. We are going to vote. We are going to vote. Honorable members, primarily the member from Willie, you better take your seat. We are going to vote. No. No. Point of order where? Please, we are voting now. We are voting, please. We are going to vote now.
What are we going to vote?
We are going to vote on two proposals. Those who are in for it to remain as it is, please. There are going to be two proposals. The proposal from All Yundum and the proposal as it is. Those who are in as it is, please. No, please. Those who are in as it is, not the proposal from All Yundum. Hello? Those who are in as it is, that is. Those who are in for the All Yundum, for the Chief Justice to appoint only the judge of the Court of Appeal judge, raise your hand. To maintain is as it is 23 and the proposal from All Yundum 12. Any order on clause 4? Parliamentary.
Honorable Chair, I made a proposal on clause 4, subclause 1, in the term limit, which is 7 years, but nothing has been said whether we accept it or not. I think we should say something about it.
A proposal 7 years. Her proposal 7 years on 3. She is proposing for 7 years. Honorable members, member for Busumbala.
Thank you very much, Honorable Chair. Honorable Chair, I may differ on her proposal based on the fact that, we need to nurture that institutional memory, Thank you.
Central Badibu.
Yeah, this is not about nurturing institutional memory because this is a commission. So who are you going to take out and remain the other ones? What we are saying, we are talking of the term. So once we make it 7 years, concurrently, this 7 years, you will serve it after that, and you are not going to have opportunity to serve again. But who are you going to maintain and who are you going to remove? Unless the member of Busumbala enlighten us.
Honorable Chair, with your permission.
No. Kiang West.
Honorable Chair, I think we have heard from both sides and we have all read what is in the document and what the proposal says. Can we quickly take a decision or we vote and move on this one? Because when we debate, it prolongs it. And we have we had the two sides. We all have a position already.
Honorable Chair, I strongly recommend that we leave it as it is.
Wuli is left.
Honorable Chair, let's leave it as it is.
Yeah, Honorable Chair, I think the best practice, other commissions, if you look at them, is the same format. Extension or reappointment should be subject to performance. And there is room for institutional memory, at least for one. When there is need for appointment, that should be based on performance. But when we make it 7 years, somebody is not performing, well, you see?
Yes, I think, thank you very much, Honorable Chair. I think we leave it as it is, please. Thank you.
Yeah, I think the consensus is to leave it as it is. Yes, any other issue on clause 4? Any other issue on clause 4? Passe?
Thank you for giving me the floor. For consistency, clause number 4, number 6B, the member of the bar association. I think we should change it and leave it as member of the bar, the Gambia bar.
It has voted already. It's because yesterday we had this.
So we need,
it's Gambia.
Yes.
It's
So
a member of. It's Gambia bar. That will change.
Yes.
Okay. It will not be from the bar association.
Yes. Okay.
It will be from a Gambia bar.
Yes. So for consistency.
Central Badibu. Thank you, Honorable Chair. Honorable Chair, the term, if they want us to maintain 5 years, I have no problem. But what I'm saying is, how can you make a commission members 5 years and the other members 4 years, and the commission is established to work as a team?
The chair talking about.
Yeah,
Any other issue?
Why is the chair?
Any other issue on clause 4? Any other issue on clause 4? Young West? Yes, a member for lawful.
Yes, I think the trend that we are going, it is not progressive. Because at most of the time, we are already divided, and the only thing that can separate us is voting. So let us not delay the voting and we move on. The speed is not okay.
It is proposed that clause 4, tenure of office as amended, stands part of the bill. Those in favor, please say aye. Those not in favor, please say no. The ayes have it. Clerk.
Clause 5, qualifications for appointment and functions of members of the commission.
Qualifications for appointment and functions of members of the commission. Clause 5. Committee members. No issue. Clause 5, any proposal or issue? It is proposed that clause 5, qualifications for appointment and functions of members of the commission without amendment stands part of the bill. Those in favor, please say aye. Those not in favor, please say no. The ayes have it.
Clause 6, functions of the commission.
Clause 6, functions of the commission. Chair, any member for Central Badibu?
Yeah. Chair, under clause 6, subclause F, recommend appropriate action to be taken against a public officer proved to have engaged in unethical conduct. So I need clarification into this by the Honorable Minister to help us. The instead of recommending, why not there is a commission to prosecute? Is it possible for the commission to prosecute?
AG.
There could be ethical issues that are not prosecutable. Because ethics, you can be in breach of an ethical conduct, but you fall short of committing a crime. Because the standard of ethics is lower than the threshold for commission of a crime. So in that situation, they can recommend probably a disciplinary action to be taken. That's what I'm saying. You may breach an ethical code, but you fall short of committing a crime. Because ethics is governed by a code of ethics. Code of ethics and the threshold there is like a standard behavior that is expected of you for being an occupant of a particular position. You may behave, your behavior may fall short of that standard, but not necessarily you are in breach of law.
Chair, follow up, then we can have both prosecute and recommend. Huh?
No, go look at H. Minority leader and member of the Cabinet.
Just one clarification. And then to whom will they recommend to?
Public officers are under the Public Service Commission, so naturally the recommendation will go to the Public Service Commission because this is specific. Recommend appropriate action to be taken against public officers. If you are a public officer, then Public Service Commission regulates you.
Any other?
No issue.
No issue. Janjamure.
Thank you very much, Chair. I just want us to look at clause I, and it reads, advice to the Attorney General to institute legal proceedings for purposes of recovery or protection of public property. And it continues. I just want to have a better understanding and if need be to suggest for the Commission to rather take legal proceedings on its own than actually seize. Thank you.
Law Abadibu.
Thank you very much, Honorable Chair. Honorable Chair, I would like to have further clarification on this. H, investigate and prosecute any acts of corruption or other matters prescribed under this act. I need further clarification on it.
Attorney General.
Yes, so now both somehow there are cross questions that relate to each other. The first question is, they still have to prosecute, but they may need more level of involvement of the Attorney General's office. That's why he says they can advise Attorney General to institute further legal proceedings where necessary, if more legal proceedings are required beyond their capacity. But H is exactly as it means, yes. They can investigate and prosecute any act of corruption committed under this act.
Yes.
Yeah. Yes, AG, but I also have a concern about instead of advice, because advice is not strong. It may be accepted by you, it might be rejected. So why not we have a strong term for it that will compel you to act?
It cannot.
Yes, I think I is appropriate because some crimes are cross-border or transboundary crimes that you will need the Attorney General, because you see, we just finished the mutual legal assistance bill that we just have. So these transboundary crimes, you will have to need their assistance to be able to prosecute. Thank you.
Proceed.
No, somebody is
Law Abadibu.
Will they recommend for prosecution or they're going to prosecute?
This is one institution we want to give capacity to prosecute. If they need assistance or they think like Honorable Mbo is saying, if it is a kind of a prosecution that is too sophisticated for them, they can refer it to the AG's chambers. But to improve on their turnaround, they should be able to investigate and deal with many of their offenses that they think they have got evidence. Yes.
Any other? It is proposed that clause 6 will is.
But from what the Central Parliament member was saying, advise the Attorney General. I was thinking we can put advise or instruct. We can, because Chair, it is, if you look at K, it is instruct, advise, and assist any officer. So they can do those type of things. So this is anti-corruption, Honorable Chair. If it is just left to the advice of the Attorney General, you understand? And the Attorney General can stop any proceedings or can discontinue any proceedings. The possibility of discontinuing this one too is there. So that's my fear. That's my fear.
Yeah.
And this is anti-corruption.
You see, there's a very big difference between K and the rest. Here, you are instructing other officers that you actually have jurisdiction over. For example, you can instruct them that you need to do A, B, and C, and D as precautionary measures to prevent corruption from happening. But to instruct the Attorney General, they cannot. The Attorney General is not under their supervision. It's not.
Okay, thank you, Chairman. I was just looking D and N, just for the advice of the Attorney General. Don't you think N is already incorporated on D? Look at N and D.
You said D and N, the last one? No, they're different. In D, you are going to be raising public awareness. N, you are enlisting and fostering public support, not only creating awareness, you are seeking. So they're different. To merely raise awareness and to proactively seek support in fighting and combating corruption are different.
It is proposed that clause 6 functions of the commission without amendment.
Honorable Chair, sorry.
Yes.
Sorry to interject.
Go ahead.
I strongly believe D is in N, because if you read D in totality, it is saying raise public awareness on ethical issues, educate the public on the dangers of corruption, and enlist public support in combating corruption. Yeah. Yeah. So I think N can just go out.
Okay, I didn't read through D to the end.
Yeah.
The last bit of the sentence, and enlist support in combating corruption, is the same as what N is saying. Enlist and foster public support in combating corruption and other offenses. Basically, it comes to the same thing, yeah. Yeah.
Nominated member Kebala. Yes, Brikamano.
Repetition in D is an enlist public support in combating corruption. I think we can do with that, and then we maintain N. No, excuse me.
Now
it is that phrase that has been repeated in N.
The member for Brikama North is proposing what is repeated in N, but the enlist and foster public support,
yeah,
we leave it.
Yes, this enlist public support.
Honorable Speaker, I think it's a good suggestion.
Yes.
So that N will stand alone as a paragraph of its own.
Yes.
As in N.
Yeah.
So the part of N that is embedded in D can be removed.
Can be removed.
So N will be left to stand alone as a because it gives it the necessary importance that it is taken care of by a paragraph of its own.
The proposal is to delete and enlist public support in combating corruption on the D, in D. And also, if you look at H, the prescribed is wrongly spelled.
No.
Look at H, investigate and prosecute any act of corruption or other matters prescribed. It should be PRE instead of O. And also J, advise, ADVICE, maybe we change it to advise. Member for Central Badibu.
Very much. Honorable Chair. Honorable Chair.
Oh, okay.
Just read N. And the only difference that you cannot find there is other offenses. So we cannot keep N in place while we have D. Either we maintain D. No. Why are you leaving N? N and B, they are the same.
It's repeated in N. Open the J in D.
No. You first deal with D, then you come to N. Delete N and adjust it on D.
It is proposed that clause 6 functions of the commission as amended stands part of the bill. Those in favor, please say aye. Those not in favor, please say no. That is it.
Clause 7, powers of the Commission.
Clause 7, powers of the commission. Clause 7, powers of the commission. Attorney General, no issues. It is proposed that clause 7, powers of the commission, stands part of the bill. Those in favor, please say aye. Those not in favor, please say no. That is it.
Clause 8, standing orders.
Clause 8.
Yeah.
Yes.
Chairman, I have a proposal on
all you do.
On clause 8, I wanted us to have a new clause that will read clause 8 instead of the current clause that you have in the original text. That is to have a clause called the exclusion of jurisdiction for clause 8 under clause 8. The Commission's power of investigation under this act shall not include the investigation of any matter that occurred before the coming into force of this act. I did the proposal already and I submitted it to your table. Yes, under clause 8. It is there.
Today?
Is it today?
Yeah, it was part of this. Yes, so the proposal from Olyundum is to amend. What is your proposal? Use your mic. Please use your mic.
The proposal is to insert a new clause that will read section 8, clause 8, sorry. And it reads,
No.
Clause 8. Now, yeah, the numbering will change. Now we'll have clause 8 to read as exclusion of jurisdiction under the powers of the Commission. We are going to insert a new clause. That's what I said. What I said, we are going to include a new clause. Exactly. Moro, you all have gone to the University of the Gambia. You should understand. The proposal says the Commission's power of investigation
The proposal from the member for Olyundum, clause 8, exclusion of jurisdiction. Honorable members,
Honorable Chair.
order,
Honorable Chair.
order, order.
This
Oliundum, please take
this
your
is beyond
seat.
consideration now.
The member for Oliundum, take your seat.
No, what is happening is beyond consideration. No, to be honest.
Now there is proposal for a new clause to be inserted before clause 8. Immediately after clause 7, a new clause to be inserted. There is a proposal to insert a new clause.
Honorable Speaker, Honorable Chair.
Now, subclause. No, it's close.
Standing order 72-7.
Now, in accordance with standing order 72-7, I'll now call on the clerk to read the clause for the first time.
New clause 8, exclusion of jurisdiction.
New clause 8, exclusion of jurisdiction, have been read for the first time. Now I will allow the proposal, the mover of the proposer to read and move the proposal for the second time.
Thank you, Honorable Chair. I move. I'm only moving that we insert a new clause, exclusive of jurisdiction, in the to be read a second time. It pass. And the text reads: the Commission's power of investigation under this Act shall not include the investigation of any matter that occurred before the coming into force of this Act.
Any seconder?
No, I'm not seconding it longer.
Now, members, please. Now, if you have issues on the proposal of the new clause, member for Woolies.
Yes, Chair. Order, order. Order, order.
Order,
yes.
Please.
Chair.
Please. Please.
Chair,
Minority Leader and Deputy Majority Leader, please order.
Truthfully, when we are lifting things, we have to look at the similarities. This is very different from the Human Rights Commission. And you know, with the Human Rights Commission, a lot of commissions were established, including TRRC, which had looked into the past. So we are trying to forget about the past animosities. This one is dealing with corruption. Those who have dealt with our finances, you know, and they have embezzled or done any other malpractices with our finances. Those are the ones we are trying to deal with. So if you, I know the Attorney General has brought reports here. There are a lot of anomalies. And we have approved here that, you know, those monies should be refunded, etc., etc. So if we put this there, it means that we are tying the hands of not only the Attorney General, but our own hands from pursuing all the lost monies that had happened. So we should not put this clause there. Please.
Please, nominated member Kebalang Fofana.
Honorable Chair, I believe Honorable Woolley is missing it. What about the Jana Commission then? If at all the TRRC was there for human rights violations, what was the purpose of the Jana Commission? Was it not for financial malpractice, corrupt activities that happened? Okay, just allow me to learn. What I'm trying to say here is there must be a startup point. There must be a cutoff period. Do we say the Anti-Corruption Commission will even look far back into history, even during the days of the slave trade? Look into the 1980s, 1970s. We must start somewhere to be productive. If you make it creepy, it becomes over-ambitious, then it will be inefficient. So I strongly believe that the proposal of the member holds water, and we should definitely support it.
Chair, member for Serekunda West.
Thank you very much, Chair. Like honorable members said, we are trying to protect people's money, national fund, you and me, our money. Yes, I agree, we can have a starting point. But if we just want to bring it as the honorable member suggested, then we are protecting people who stole our money. And the objective of this bill is to protect national cake. If I am to agree with him to have a starting point, then let it start from 1965. Anything that happened from 1965 to date, rather than just having it just as it comes into effect.
Thank you. Janjambure, Chair. Janjambure, then Foni Jara.
Thank you very much, Honorable Chair. I think I'm going all out against that motion or proposal from a colleague member. I don't really understand if this is not a way to actually discredit the audit report, for example. I don't, in fact, have to go far to look at TRRC or the Jana Commission. As much as we need a starting point, I think to start with, more especially with corruption issues, we should really look at things way back, not just, starting to enforce things by the time this document is ready. We should take things seriously. Thank you.
Thank you very much, honorable member.
Yes.
I think
order.
The Anti-Corruption Commission is not setting out any other report or any motion moved by the National Assembly or any investigations. So, but I will allow the Attorney General, then Jara, Foni Jarol.
Point of order.
Let me assist the debate a little bit.
Yes, there's point of order, Honorable Minister. Can we have a point of order?
Yes, Honorable Chair, the procedure of how this proposal is introduced doesn't go in line with our standing order. Yes, because 72 consideration stage, you need to tell us whether the mover or the honorable member will only send a proposal to you. The standing order is clear with the timing of the proposal. And you haven't shown us any proposal being submitted by him. No.
Now, I said in accordance with Standing Order 72-7. It was on those bases that the new proposal is being introduced. And it has been read for the first time. And also, it was, please, order. It was seconded by the member for Lower Fuladu West. Yes. Please. Read 72-7. Yes. After the motion has been seconded, then debate will ensue.
Yes.
Read, please. Now, Attorney General.
Yeah. This proposal, I believe, is emphasizing clarity. Like when you say for the avoidance of doubt. But strictly speaking, the Commission's power starts from when this act comes into being. So they cannot prosecute anybody for something that happened outside of this act because their power, this is the creature, this is the document that creates them. All right? So the proposal maybe is like when you are talking and you just say for the avoidance of doubt, maybe for emphasis, for clarity, but you don't envisage this commission. For those of you who are concerned about the existing corrupt practices that are going on, be rest assured, we have sufficient laws to prosecute corruption, even as we speak now. And if anybody is implicated in any kind of corruption, even without the Anti-Corruption Act, there are sufficient laws to charge you. There is offense called public, we're charging people for official corruption. We are prosecuting people for official corruption. That's already in our criminal code. So to fear that if this commission doesn't have a retrospective power, some people will escape justice. No, if they are investigated and there is evidence, we have sufficient law to prosecute. This commission, its power is emanating from this act, and it only takes its power from the moment it is set up. So I don't think you should spend a long time in debating this. Yes.
Minister,
it's a clarification. The clause is only to say, for the avoidance of doubt, let us be clear that this is the position. Yeah.
Thank you, Minister. Fonyi Jarol.
Fonyi Bintankarana.
Fonyi Bintankarana.
Thank you. Honorable Chair, I am in agreement with the Deputy Majority Leader, member for All Yundum. That is, the act cannot be older than itself, meaning it only comes into effect when it is laid and pass all the procedure. That is the time the act comes into effect. Because we cannot start since 1965 or since 1950 when the colonial masters were here. So I think it's a simple logic that people need to understand, because if not, we are going to overload the commission with a lot of responsibilities. They will go and dig other people in their grave to come and commission them, which will be very bad.
Thank you. We'll have Kiang West, then Brikamanot.
Honorable Chair, we are defeating the purpose of this document. I beg to differ with the Honorable Minister that we have sufficient laws to follow corrupt practices and prosecute them. If we do, why do we need this document? Then if we do, then we don't see political will in the government to do it. Government is not ready to fight it. So this is why we have in a document. Who steal money that we are trying to protect? No. Don't say that. Who steal money that we are protecting? Let's leave the document. Let's have a time from 1996, in fact 1994. Let's have from 22nd July 1994.
Now, why 22nd July 1994?
Why 1994?
I am confused with that statement.
Why 1994? I'm not from Matukoid.
Please,
1965.
please, don't use the mic, please. Member for Brikama North and Minority Leader.
Honorable Chair, let's be mindful that when this bill was laid and then committed to a competent committee, they did their work thoroughly and diligently. Experts were consulted. The tail end, they were able to produce this report. If at all what the mover is moving is very salient, I am with the view that the FPAC will not ignore that. We are not saying that the avoidance of doubt, there's no doubt. Whether it's there or not, this is not starting. It is not going to be backdating. That is your fear. No, I'm coming. It is not relevant here. It's not relevant. Fine. Now the thing is, let's not overload it. No. We live as it is. Your fear will be alive. It's just not going to be there. Please.
Order, order, order. The Honorable Minority Leader is suggesting that his fears are laid inside the bill. Why not, for avoidance of doubts, to put it there? The member for Central Badibu.
Thank you so much. Honorable Chair, thank you. And we have heard the Minister and other colleagues. We thank you all for your contribution. But Honorable Chair, with all due respect, these are documents belonging to the Gambian people, not a particular group. And these laws are here for posterity. Let us not try to bring up something that's going to bring a lot of debate. Because if you said it should not be there, I will think that you have something to hide. Or there is a group that you are protecting. We are not here for that. The law is neutral, the law is impartial, the law is independent. So please allow us to move as it is. If you refuse, you put it to vote. Chair, put it to vote.
Member for Woolly is.
Chair, I want us to look at, if we look at 88, the repeal and savings. If we look at the repeal and savings, 88 of the act, of the bill. Clause 88. You don't know clause 88. No, the whole of 88, entirety.
No.
So this, Chair, this bill is supposed to repeal the 2012 Act. Okay, and he's saying, notwithstanding the repeal, any action or progress started under the Repeal Act, insofar as it is not inconsistent with this Act, shall remain in operation until revoked. B, any proceedings commenced under the repeal law shall be deemed to be validly commenced. C, the purchases and acquisitions made under the Repeal Act are considered to have been made under this Act. So if you put this clause, would that not contradict this one somehow?
Please, honorable member, thank you. What he is saying, now we are on clause 8. When we get to that, if there is a need to do...
No.
Please, order. Please, where you submitted your contribution. Sorry, the member for Woolly is.
Chair.
If there are any other issues as we progress, if there are any need to do amend, or we will get there. But now we are on clause 8. The member for Upper Salem.
No. Yes, Chair. I was just going to refer to the chairperson of FPAC. You know, he's right. We as a committee in the Fifth Legislature, we did a very good job on this report and presented a report. But yesterday, he was the very one that actually questioned our recommendation. And he was dribbling all over the place. So today, he's kind of like changing completely.
Yesterday, I don't go outside.
No.
The FPAC report. Maybe you were not here. No, I was not. I was not.
Majority leader, please. Please, member for Lower Salon.
Actually, Honorable Chair, the essence of these documents is not for witch hunting. We want to build our nation. And again, there is no law that we can intro active laws Parliament to be passed in Parliament. Chair, I beg with the members of Parliament, already there is an anti-corruption bill act in 2012, which whoever is found guilty, the law will take its course. Honorable Chair, then the submission of the member, let's go by that, because you don't know. In fact, it might be you suspect somebody to be in that hot soup. It means you yourself will be there.
Thank you. The member for Joshua. Banjul North, Nyame Dankung. Joshua, please, you have the floor.
Yeah. Thank you very much. I think,
Honorable Chair, Honorable Chair, ask the member for Central Badu to withdraw that word. Just, you said it's useless. You said it.
Honorable member for Central
Talk,
Badibu.
talk to him before I make.
Honorable member, sorry, yeah, honorable member for Central Badibu. Did you say that? You said
No, you take an oath.
You did not give me the floor. How can I talk?
Take an oath.
Please, honorable member for Lower Salon, please.
I'm not on the floor.
Sorry, hold on.
I didn't talk. Honestly, I didn't talk.
Member for Central Badu.
I said we have better laws which can take care of that.
Have you used the word?
No.
All right, thank you. The member for Joshua.
Thank you very much, Chair. I mean, I think the Honorable Minister should guide us here.
The member for Janjambure, please, let's maintain the quorum.
Honorable Chair, I think we have to be very careful here. This is not for a group of people or this is not for a group of people or we are targeting individuals. My question to the minister is this. This is a law that we are trying to bring into force. I think he will be in a better position to explain when shall it start. A new law that comes into force start with effect the moment it is passed. So why do you want to backdate to say we should be going A, B, C, and D? I think it only starts with effect the moment it is passed. That's the time it goes as a law, and that's the time it starts hunting people. But if you want to bring it back to say let's start from this number, I mean this targeted year. How about the previous years behind that? I think I think we need to change things now and know that it is meant for a purpose, and the moment it is being passed, that's where it starts.
Thank you, member for Joshua. Member for Brikama North. Sorry, not Brikama North.
I'm only just telling you.
No, Banjul
He's
North.
taking care.
No, don't use so much. Banjul North.
Honorable Chair, for me, what I just want to say is that.
Right now, please allow the Banjul North, then I come to you. Banjul North.
Honorable Chair, what I just want to say is that let us not downplay this document. It is very clear. Something is drafted and been handed over to us to scrutinize. Let us do what we're supposed to do. I think coming up with such a proposal might commit, let's say, contradiction as far as Honorable Member for Wule is concerned with the other clause, that is clause 88 of this bill. So I think let us just leave it as it is.
The proposal, you are in line with the proposal from...
I am not.
Member for Nyamina Dankuku.
Okay, thank you very much, Chair.